Hello, my name is ASangraw and my research is on breast cancer. What is breast cancer? Breast cancer is the most common type of cancer in women in the United States. This is excluding skin cancers though. It's the second most frequent cause of death from cancer in women. It's a disease in which normal cells in the breast begin to grow without control, and no longer die. Signs and symptoms of breast cancer. When breast cancer is discovered early, there are many more treatment options available. There's also a much better chance of cure when it's discovered early. Breast lumps aren't always cancerous, but breast lumps are the most common sign of breast cancer. So when you find a lump, often it's very painless, and so you don't think anything of it. Thickening in the breast is also another symptom or sign. Other ones include spontaneous clear fluid or bloody discharge from the nipple, retraction or indentation of the nipple, changes in the size or contours of the breast, flattening or indentation of the skin over the breast. So here's a picture that shows what to look for when you're looking for visible signs of or symptoms of breast cancer. So you've got the lump, the pulled in nipple, dimpling, dripping of discharge. Redness is also a sign. Skin changes, anything should be looked for and brought to your doctor's attention if you find anything. Causes of breast cancer. Cells in the breast begin to grow abnormally. Breast cancer cells divide more rapidly and may spread, which is also called metastasize, throughout the breast to the lymph nodes or other parts of the body. The most common type of breast cancer begins in the milk-producing ducts, but it may also begin in the lobules or other breast tissue. In most cases, it isn't clear what causes normal breast cells to become cancerous, so there's still lots of research being done on breast cancer. There are risk factors for breast cancer. Age is one of them. Sex, obviously, it's more common in female. Family history, so if there's a family history, there could be a chance that you could get it, so definitely there should be more watching for it and watching for signs and symptoms of it. Others include weight, smoking, poor diet, which these can be controlled. So you need to be healthy and watch your weight and try not to smoke and eat healthy. Radiation exposure can increase your chance. So also, again, excess weight, so being overweight. Late menopause is a risk factor. Having your first pregnancy at an older age. Hormone therapy, birth control pills, as many of us have heard, can be a major risk factor in breast cancer. And also excessive use of alcohol can be a risk factor in breast cancer. So when should you see the doctor? So although breast changes are not cancerous, it's important to have them evaluated though. So you should let your doctor know of any unusual things that are happening, the changes in your breast. So discovery of a lump or any other warning signs of breast cancer, especially if the changes persist or after one menstrual cycle or change the appearance of the breast. If being treated for breast cancer, report any new signs or symptoms immediately because this is not good. Possible warning signs include a new lump in the breast, bone aches, or pain that doesn't go away after 3 weeks. These all should be notified to the doctor immediately. Screening and diagnosis. Screening, looking for evidence of a disease before signs and symptoms appear, is key to finding breast cancer in an early and treatable stage. Depending on the age and risk factors, screening may include self-examination, examination by a nurse or doctor, or mammograms or other tests. So screening for your self-examination, this is how it's done, and it should be done frequently. So you either want to be lying down mainly, if you can, and you just pretty much feel for any lumps or any weird, unusual feelings in your breast. And again, if you find anything, notify the doctor. Other screenings and stuff are clinical breast exams, a mammogram to check breast tissue. So it's a big machine and it pretty much x-rays the breast. So other tests include computer-aided detection, which is also called CAD, digital mammography, MRI, breast ultrasound. Some experimental procedures include ductal lavage or a molecular breast imaging, MBI. There's also ultrasounds, a biopsy, which is a needle, which is drawing the sample fluid from either the lump or the tissue. Estrogen and proestrogen receptor tests, staging tests, which is stages 0 through 5, genetic stage, and treatment. In addition to coping with potentially life-threatening illness, breast cancer patients must make difficult decisions about treatment. Treatment exists for every type and every stage of breast cancer. Most women have surgery and an additional therapy such as radiation, chemotherapy, or hormone therapy. Experimental treatments are also available at cancer treatment centers. So when surgery is done, a lot of the times there is other options to make you feel more like a woman again. So a lot of times your insurance will cover that as well. So this is all the facts that there is for about breast cancer research. There's still so much studying being done in it, and I hope they find a major come through with this and treatment available for when it does happen to women. And these are my references.